So I did my project on the UCL injury. So what is a UCL injury? An ulnar injury is an injury common for throwing athletes and those that use their upper extremities frequently. This can come from an acute injury or an insidious injury, so a chronic or onset injury. What are the signs and symptoms? So certain signs and symptoms include pain on the medial part of the elbow, swelling, a sense of looseness or instability in the elbow, irritation of the funny bone ulnar nerve. This is felt by tingling or numbness in the small fingers, so which includes the metaphalanges, and decrease in velocity. How do you test? So you will palpate the bicep tendons, bicep long heads, bicep short heads, radial tuberosity, head of the radius, cranium, triceps, and coronoid. So what I did after that, after all the testing, you would do a rehabilitation. So for the rehabilitation, the conservative treatments include, but are not limited to resting, anti-inflammatories, bracing, price, and ice. For rehabilitation, the continuation is also immobilization, decreasing pain using unhinged brace modalities, which I put TENS units in STEM, gentle range of motion isometric, total arm strength rehab, eccentric muscle work for the wrist, RTC stabilizers, which progress to plyometrics, and controlled valgus 90-90 shoulder medial ball toss in the later stages. So this is towards the end stages. If all of this, despite the conservative treatment, surgical interventions may be used. So if this conservative treatments are not working, or you see that the individual is not rehabbing well, there may be a need for a surgical intervention. For the return to play, the athlete needs to be in pain-free when throwing. The elbow and shoulder range of motion has returned to the normal limits. Forearm strength has returned back to the baseline, and good throwing biomechanics have been established.